Hey everybody, welcome back to Beauty Therapy Sundays. Hope you're having a great Sunday so far. So you guys, as promised, I wanted to talk to you guys about micro-needling. So I did have micro-needling done about a week ago. And I don't know if you know about micro-needling, but what they do is they use a sterile surgical needle appliance and they do these micro injuries all over your face, like thousands of little punctures all over your face. And what that does, it tells your skin, oh my God, I need to heal myself. So the collagen, it stimulates the collagen reproduction. It stimulates the fibroblasts underneath the skin. So therefore, your skin will start to look more radiant, fuller, smoother. Now, I've never had anything done invasive before. This is my first time, you guys. I've never had fillers. I've never had Botox. I don't have any problem with anyone doing any of that stuff, okay? But I just wanted to try something more natural. I was at my dermatologist about 2 months ago, and we were just I was talking about fillers down here because, I'm aging a little bit. I'm 150 years old. And I told her, but my esthetician was talking about micro-needling, and she goes, Marcus, that will work. She goes, you have to do several treatments, but it does work. So I talked to Alicia about it, my esthetician, and she said, yeah, we'll do it. So she decided I only needed about 3 sessions. So usually they will do 3 to 6 sessions on your face, but she told me my skin would respond to probably 3 sessions. And honestly, it responded very well to the first session. And somebody asked me a while back, they said, Marcus, do you have cheek implants? And I said, no, sweetheart. I said, my mother, she implanted these when I was born. All right, my mother had very high cheekbones. But anyway, I want to take you on this journey of microneedling. It's a wonderful process that you can use to tighten your skin, to plump your skin, to smooth out your lines. So this was the first day. This was my first day of microneedling. As you can see, I was really, really sort of bruised, all right? But my esthetician told me everything I needed to do for aftercare. This is day 2. She had me use a soothing aloe mask, day 2. And actually, you could see that things were starting to look better. Now, day 3, I added rose hip oil to my regimen just to help soothe my skin. And you can see there's minimal swelling and minimal redness on day 3. Now, day 4, you also see there's less swelling and also less redness on day 4. And then, of course, day 5, I was almost back to normal. And here we are, day 7. I'm looking at you now on the camera, and my skin looks really great. So I have another session scheduled for 6 weeks from now. You always have to schedule these appointments 6 to 7 weeks apart. So I do have another appointment scheduled for another microneedling in about 6 weeks, all right? So I'm going to take you on this little journey to microneedling. I'm going to show you, and Alicia's going to show you the entire process. So don't go away. We'll be right back. Oh, honey, I got to get me some coffee before we start, before I get on the road,
I can help you.
Good morning. Could I have a large iced coffee with cream, please?
Okay.
That's going to be it.
Please go on.
I need my coffee to get started. I can't drive without my coffee in the morning. Good morning. How are you? Haven't seen you in a while.
You feeling good?
I'm doing great.
Good.
Yeah.
Is it the Ozempic that you're taking?
No, just myself. Just doing it on my own.
Oh.
Yeah, I'm doing it on my own. Yeah, I lost 85 pounds over the last couple of years. So.
You did great.
Thank you.
I am so proud of
Thank
you.
you.
Yeah, I wish I sent some of that over my way so I can do it. I'm telling you, you look great.
Thank you.
Right.
Take
Good to
care.
see you.
Thank you. You too. All right, so I'm just gonna put my little ice I'm sorry, put my little sweetener, artificial sweetener in my coffee, and then we can get rolling, y'all. You know, I use Truvia, you know, so I know you guys know I lost 85 pounds over the last couple years, so I'm trying to keep it up. I've been keeping it off, and I'm very grateful for that. I feel really great, and thank you guys for your support. But anyway, you know what, you guys? I wonder if this procedure hurts. I'm scared, y'all. I'm just teasing. All right, you guys, I'll get back to you when we get to Alicia's, all right? All right, you guys, I have arrived at my Alicia's Flawless Beauty by Alicia. Alicia! Hey, Alicia! How are you, my love? Happy belated birthday, too.
Oh, and you too?
Oh, thank you.
That was last year.
Right.
Who's counting?
Exactly.
Who's counting?
Exactly. Help me, Alicia. Look at me, girl. I need your help. Help me. Help me.
Well, let's talk a little bit before we start.
Okay.
I just want to introduce your audience into what I'm doing.
Okay.
So, in permanent makeup, it's called scar revision.
Okay.
In medical aesthetics, it's called mico-needling.
Okay.
Which is another name for collagen induction.
Okay.
So what it does is it creates minor injuries to the skin.
Okay.
And then your body tells itself you have to go there and repair.
Okay.
And it wakes up the fibroblasts. And as you know, as we age,
Yeah.
our fibroblast is almost on retirement.
Yeah, I know, girl. Man has been retired for years. Okay.
And so this treatment kind of wakes it up and say, hey, you're not done yet.
Okay.
You need to wake up and start going to work.
Yeah, I was trying to explain it to my friend as I was driving here. He was asking me questions about it. I said, I think they create those like micro injuries or something like that. That's what it's called. And then your skin kind of like says, okay, let's repair.
So I like to do it in layman's term when I explain it to my clients. It's like when you get a cut, and then once it healed, do you ever notice that scar heals lighter?
Yes.
And a little plumper than the rest of your skin?
Yes.
Okay.
So that's kind of like the
that's
idea.
Like the idea of it. That's like the best way I can describe it in terms of what people will understand.
Yeah.
That's like how I describe, moisturize. If you don't moisturize, there's a difference between a grape and a raisin. Okay,
yeah. Yeah, exactly. Totally,
and
totally.
They totally get it.
Yeah, exactly.
And they find it amusing.
Exactly. One question. Does it hurt?
I numb you.
Okay, great. Okay.
So you're going to get numb for, I'm going to wash your face.
Okay, because I only put on moisturizer and sunscreen. That's all I have. That's all I did.
And the thing with this is you have to make sure whoever's doing it to you or for you, not doing it to you. Right. Do it to you.
Right, exactly. Well, no one's going to do it to me but you anyway, so we don't have to talk about that.
But I'm saying
other people.
Audience,
right, exactly.
You have to make sure that you're getting it done in a really reputable place where it's very hygienic.
Yes, of course. Because you get infections, right?
Yes, and they're throwing away the needles.
Yeah, exactly.
And also they're wrapping the machine.
Yes.
Okay.
Exactly.
And also, you want to make sure that they're wearing gloves.
Of course, yes. Yeah, exactly.
Exactly,
yeah.
And also Aftercare. And they're like explaining how Aftercare.
And we'll talk about that after we get done. We'll explain that to the audience.
Yeah, and those glasses are so cool.
Thank you, darling. Okay, well, let's get started. She's cleansing my skin right now, you guys, because I put a little bit of moisturizer and sunscreen on. And she's actually going to do a little micro needling on my neck too, because, just the little giblets going on,
and just for them to know, even if your face you think was already clean,
you still need to do it again.
Always do it right before the treatment.
Excellent. All right, you guys, she's getting ready to numb me now. She's numbing my skin so that I won't feel as much, but I'm not that really, pain sensitive anyway when it comes to stuff like that. I've had so much stuff done to my skin, but this is, like I said, this is the first minimally invasive thing I've ever done. So, but Alicia's so amazing at everything she does. Aww. So I know she would take good great care of me and you too.
Oh. So I just want to put a layer in, and then we're going to leave it on for 20 minutes.
Okay.
Your skin might start feeling a little cold.
Okay.
That just means that
It's numbing, right?
Yeah.
Okay.
The numbing is taking effect.
Okay. All right. All right, guys. She's gonna leave this on for 20 minutes. So she applied it. She applied it everywhere, and I do feel it cooling now. And she's gonna do my neck. She's gonna do under my eyes. So I'm looking forward to seeing the results of this wonderful, minimally invasive treatment. Guys, she's just removing she's washing off the numbing cream now.
Okay, so I double cleanse all of the numbing cream off. Now I'm just going to use this hospital grade antiseptic to disinfect his skin even more, because we want to make sure that there's no bacteria on the surface of his skin. So we don't want any kind of infection to happen. Okay guys, as you see, I like to really wrap my machine up with plastic to prevent any cross-contamination. I also like to keep my needle in the sanitized package, and I usually open it in front of my client to let them know that this is a brand new needle and it's not reused ever. So I like to start at a high speed, and I like to start on the forehead. Now keep in mind the forehead is it's pretty much skin and bone, so I like to go a very low setting as far as the needle depth. Okay, so I'm just gonna put some hyaluronic acid on top of his forehead before I start mico-needling. And the reason for that is it's going to add moisture to his skin, and it also is going to give me that glide, so I'm not dragging the needle across his skin causing damage. Here we go. Ready? Mm-hmm. How does that feel?
Feels great.
Do you feel anything?
Just a tiny little rubbing, but nothing, yeah.
So that
numbing cream really helps.
So guys, I like to do cross hatching. You know, I usually try to do it 3 times per area. You can also do circles. So as you can see, he's starting to get a little red. And I like to just make sure I do not push the machine down. Just trust your setting. Don't push hard. So little pinpoint bleeding is normal for this. Okay, so don't freak out if you see it. But I also want to do a stamping method. So he has a start of like some fine lines on his forehead. And with that, I like to do a stamping method. So this really gets in a little bit deeper to break up the tissue so that tissue can rebuild. Alright, I'm adding more hyaluronic acid to his cheek. Now that we're going to do his cheek, which tends to be a thicker area of the face, I'm going to make the depth of my needle a little deeper, or a little longer.
This is amazing, Alicia. This is so interesting, though, you know?
Yeah, it's fascinating.
It's fascinating.
Okay, because he has deeper lines here, I'm also going to go ahead and do the stamping method right here. All right, so now we're gonna do underneath his eyes. So very important, you have to pull the eye down or underneath the eye down, and you're only gonna microneedle on the orbited bone, which you can feel. You never wanna microneedle in here, okay? Because the skin is very thin, and you don't wanna take that chance. Alright, since he has a lot of indentation, I'm going to go ahead and do some stamping on here too.
Yeah, that's not a problem area. That's why I show my age, Alicia.
That's okay, me too.
So it feels like she's going a little deeper here, guys, which I need that because, like I said, it is I consider it my problem area.
And you can see some pinpoint bleeding.
Yeah.
But that's totally normal. So the hyaluronic acid I'm using, try to get the most natural one if you're going to use it, because this doesn't have any dimethicone or silicone. So you want to make sure you don't have that, because dimethicone and silicone is synthetic and you don't want to push that into your skin.
Okay, good to know.
Okay, since we're going to do your neck next, I'm going to lower my needle depth because the skin on the neck is a lot thinner.
Yes, girl, get that giblet. That little giblet under there, girl. That little, when they talk turkey, gobble, 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 gobble under there, honey. We need to tighten that up, girl. We need that collagen to really get active.
Wake up those fibroblasts.
Exactly.
You're not retiring yet.
Exactly.
Okay, so you see some pinpoint bleeding. I did his neck, his chin. Pinpoint bleeding is totally normal. You just don't want to see like really like gushing bleeding. But as you see, he's a little red. And that's just from the inflammation from this advanced treatment. Totally normal. All of this should disappear in 3 to 5 days. Maybe some people recover even faster. Okay, so now I'm going to do a little red light therapy. The reason why I want to do red light therapy, it's like helps the inflammation to calm down. It helps the healing process, and also it's good for skin regeneration. And we want to make sure we protect his eyes. And I'm going to do about 10 minutes of LED light on him.
All right, you guys, she just finished the red light therapy, and it's actually calmed down a little bit. It's definitely calmed down a little bit, but I do look like I've been in a bar fight, honey. But that's all right. It's going to work out in the end, all right?
And I just want to say, because this is Marcus' first time doing this treatment, and he doesn't do a lot of advanced treatment. I didn't go too aggressive on him, so I kept it like pretty mild as far as the depth of the needle and the amount of time that I went over an area. Yeah. But next time we might go deeper.
So get me. All right, you guys. Here is the finished product. I'm all red and inflamed, but it feels a little tight. She said it feels a little tight. But you want to tell me what I need to be doing, Alicia?
So, for 24 hours, I don't want you to use anything except the hyaluronic acid. I did put some sunblock on him before we go out. Other than that, you want to wait 24 hours. And then tomorrow, I want you to use a gentle cleanser.
Okay, I have that.
And then you can use more hyaluronic acid, moisturizer, and sunblock if you go out.
Okay, all right. But for the next couple weeks, you just wanted me to keep this really simple, right?
Very, well, not a couple, I mean, like I would say maybe 7 to 10 days.
Okay, all right.
Nothing no acids, no vitamin C, no
she knows,
retinol.
honey, I'll be burning it off in the middle. She told me, I'll be peeling it, baby, trying to keep it young, right, Alicia?
I mean, you might be tempted.
Okay, I won't.
But you don't want to irritate your skin. Your skin's already inflamed.
Yeah, exactly. Yeah.
So we don't want to irritate it more. Yeah. Very important. Make sure you sleep on a very freshly laundered pillow tonight.
Isn't that interesting, you guys? She told me to make sure that I change my bed tonight. My pillow needs to be freshly washed.
Right.
Whatever,
a lot of people
linen.
forget about those little small
details.
details.
Exactly. Yeah. That's why I always go to her, obviously.
When you take a shower, try not to shower really hot water.
Okay.
Okay.
Just warm,
and try not to put your face at the shower head. Into the shower head. Okay.
All right.
And also important, which I know a lot of estheticians don't tell their clients, but I always did. If you wear sunglasses, if you wear reading glasses, I always give them alcohol pads to take, and I always tell them to clean the
rim of the glass. She had me do that a few minutes ago, you guys, because we're going to go out, because we're going to go to lunch. We always have to make this a day.
Well,
and so,
it's because we never get to spend time together. Right. We're so busy.
Right. And she just said, make sure, she said, Marcus, I want you to clean those glasses before you leave. So see, those little things.
Little things count.
Yeah, they do.
You know, I mean, especially when you do an advanced treatment, you want to be so careful with what you do after, not just before or during, right? And my thing is, I love to educate my clients.
Yeah, she does. She's really, really into education. She's very, very into education. So I like that. Okay. And educating us too.
Yeah, and it's fascinating to me. Yeah. I mean, I've always, and I'm not a big science person, but when I got into aesthetics, I found like, wow.
Your love for science was
my love for science was awakened, and I was like, who knew?
Yeah. So we're gonna go to lunch, you guys. Don't I look beautiful?
My makeup's on point.
Right, exactly.
That's how that goes.
Exactly. We'll show you guys where we're gonna go eat too. Okay. All right. See you guys in a bit. All right, guys, we're going to eat. I'm so hungry. You hungry, Alicia?
Oh, yeah.
I have my sunglasses. I have to be incognito now, honey, because I'm inflamed. But we're going to have a wonderful lunch. I'm excited. We're going to go to a Vietnamese restaurant, Alicia? Okay, yeah. I'm excited. I'll show you when we get there. So here we are, you guys, at Viet Taste. V Taste, like Vietnam taste. It smells so good. Oh, you guys, this looks so good. Look at this. Oh, it looks delicious, doesn't it? Oh, we got chicken on a stick. We got our spring rolls, and we have crab rangoon. Yum, 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 yum. You guys, this is actually fried rice with chicken. Doesn't that look delicious? It's fried rice with chicken. Yum. All right, guys, Alicia and I have had our wonderful lunch. It was great, wasn't it, Alicia? It was so good. It was so good, you guys. So anyway, she's going to drop me off at my car, and then I'm going to be on my way home, all right? So stay tuned also for life lessons, all right? Check in with you later. All right, you guys, I'm going to end today talking about self-care, all right? There is nothing more valuable than you, all right? So you have to take care of yourself. One of the things that brings me so much joy is having a facial. So just remember, if your cup is not full, if your cup is not full of happiness and joy and self-care, you have nothing to give anyone else. You can't give anybody anything if your cup is empty, right? So anyway, if you don't have time for self-care, you need to make time, all right? If you haven't subscribed to my channel, please do that. Please like, share, and comment. Remember, I always respond to all your comments. And if you're going to be in Chicago, if you're going to be in the Chicago area, please make an appointment with my Alicia, honey. She will have that skin glowing, I'm telling you. And she also wanted me to tell you that if you mention my name and you mention this video, she will give you a discount on micro-needling services, all right? So keep that in mind. Please contact her and make an appointment if you're going to be in the area, all right? So I want to end with saying, please keep your ears open. Please keep your eyes open. Please keep your heart open, because I know love is going to find you today, okay? So thank you so much for tuning in, you guys, and I will see you next time. Always sending you loads and loads of love. Mwah.